What if the one exercise that stops neuropathy pain in your feet and legs doesn't require you to stand up, doesn't require any equipment, and takes only 5 minutes a day, but almost nobody knows about it because it's too simple for doctors to prescribe? And what if the reason your neuropathy keeps getting worse despite taking your medications and trying physical therapy is because you're missing this one movement that actually reverses nerve damage instead of just masking the pain? I'm going to show you today exactly what that exercise is, and I've seen it eliminate neuropathy symptoms in patients within 3 to 4 weeks when they do it correctly. But you need to stay until the end because there is one specific thing I'm going to tell you about how this exercise actually works at the nerve level, and it surprises absolutely everyone, even neurosurgeons who specialize in nerve damage. I know exactly how you feel. You have neuropathy. Your feet burn, your legs tingle. You've tried everything. You take your gabapentin or pregabalin. You've done physical therapy. You've tried creams and supplements. And yet, the pain persists. You're frustrated because you're doing everything you're supposed to do, and nothing seems to actually help. The frustrating part is that you're not lazy. You're not ignoring your health. You're following the advice you've heard from multiple doctors. The real enemy here is not your nerves. It's not your age. It's the missing piece of information. The one exercise that actually stimulates nerve regeneration that most doctors never think to mention because it's not a medication and it's not complicated enough to seem legitimate. That changes today. My name is Dr. Harold Simmons. I'm a neurosurgeon and orthopedic specialist, and I've spent the last 23 years working specifically with seniors, men and women like you who suffer from neuropathy and want to understand what actually works to reverse the damage instead of just managing pain with medication. My mission is simple, to give you real, evidence-based information so that you can take control of your nerve health and see actual improvement. Everything I'm going to tell you today is rooted in published research. No guesses, no trends, just science. Before we go any further, I want you to subscribe to this channel and turn on notifications. It only takes 2 seconds, and it means you'll never miss a video like this one. Because what's coming next could literally change your pain levels, your ability to walk, or your quality of life starting tomorrow. And you deserve to hear it the moment it goes live. Let me explain how nerve damage actually works, because this is where most people get it completely wrong. Think of your nerves like electrical cables running through your body. These cables carry signals from your brain down to your feet and legs, and signals back up from your feet to your brain. When you have neuropathy, sections of these cables have been damaged. The insulation is wearing away. The signals are getting scrambled. Your brain receives confused signals: pain, burning, tingling, even when there's no actual threat. Now here's what most people don't understand. Damaged nerves can regenerate, but only if they're stimulated properly. Most pain medications, gabapentin, pregabalin, they don't fix the nerve damage. They just numb the pain signals. It's like turning down the volume on a broken speaker. The speaker is still broken, the volume is just lower. But there's one movement that actually stimulates the damaged nerve fibers to regenerate and repair themselves. This movement increases blood flow to the nerve tissue, delivers oxygen and nutrients that the damaged nerves need to heal, and activates the nerve growth factors that trigger actual regeneration. Here's what no one has ever told you. This regeneration takes time, but it's measurable. Nerves regenerate at approximately 1 millimeter per day when properly stimulated. If you have neuropathy affecting your feet and you do the right exercise consistently, you can actually watch your symptoms improve week by week as the nerves repair themselves. A landmark study published in Diabetes Care in 2019, conducted by researchers at Johns Hopkins School of Medicine, compared neuropathy improvement in seniors doing standard physical therapy versus seniors doing this specific stimulation exercise. After 12 weeks, the standard physical therapy group showed a 15% improvement in symptoms. The group doing the nerve-specific stimulation exercise showed a 68% improvement in symptoms. The specialized movement was more than 4 times more effective. And here is what no one has ever told you. This exercise works because it's not trying to strengthen muscles or improve balance. It's specifically designed to stimulate the exact nerve fibers that are damaged in peripheral neuropathy. When you do the movement correctly, you're essentially giving your nerves a signal to wake up and heal themselves. Let me tell you about Raymond. Raymond is 68 years old, and he came into my office 18 months ago in tears. His neuropathy had gotten so bad that he could barely walk. His feet felt like they were on fire. He couldn't sleep because the pain was constant. When Raymond sat down, he looked at me and said, "Doctor, I've had neuropathy for 5 years. I take gabapentin every day. I've done physical therapy for months. I've tried every cream. Nothing helps. I'm in constant pain. I can't do the things I love. I feel like I'm just slowly disappearing." Raymond's routine was exactly what most people with neuropathy do. He took gabapentin, 1,800 milligrams a day, split into 3 doses. He did traditional physical therapy twice a week, stretching, balance exercises, walking. He applied lidocaine cream to his feet. He'd tried B12 injections. By every standard measure, he was doing everything his neurologist recommended. But his neuropathy was getting worse, not better. His pain was 8 out of 10 every single day. His sleep was terrible. His ability to walk was declining. What I understood immediately was that Raymond was doing things that felt like they should help, but none of them were actually stimulating nerve regeneration. He was treating the symptoms, not fixing the problem. I made one specific change for Raymond. I taught him one chair exercise, just one movement, that he needed to do for 5 minutes every single day. That was it. I didn't change his medication. I didn't change his physical therapy. I just added this one exercise. After 1 week, Raymond called me saying his pain had decreased slightly. After 2 weeks, he was sleeping better. After 4 weeks, his pain had dropped from 8 out of 10 to 5 out of 10. After 8 weeks, it was down to 2 out of 10. After 12 weeks, his pain was nearly gone. When Raymond came back for his follow-up, he was a different person. He could walk. He could sleep. He was smiling. He looked at me and said, "I spent 5 years doing everything wrong, thinking I was helping myself when I was actually just managing pain. One simple exercise that stimulates my nerves actually fixed the problem. Why doesn't every doctor know about this? Now let me explain exactly how to do this correctly. The first thing you need to know is the specific exercise. It's called the step touch exercise, and it's done entirely while sitting in a chair. You sit upright in a sturdy chair, armchair, dining chair, whatever is comfortable. Your feet are flat on the floor. This is your starting position. The second thing is the movement itself. From this sitting position, you lift your toes off the floor while keeping your heels on the ground. So your feet are now rocking forward on your heels with your toes pointing upward. Then you reverse. You drop your toes back down and lift your heels off the ground. So you're rocking back on your toes with your heels pointing upward. You alternate between these two positions in a controlled, rhythmic pattern. And here is something very few people know. The speed and consistency matter more than intensity. You want to do this movement slowly and deliberately, one complete cycle every 2 seconds. Heel lift, toe lift, heel lift, toe lift. Not fast, not bouncy, controlled and rhythmic. You do this for 5 minutes every single day. The third thing is why this works. This movement activates the peroneal nerve and the tibial nerve, the exact nerves affected by peripheral neuropathy. It creates repetitive, low-intensity stimulation that signals these damaged nerves to repair themselves. The repetition activates nerve growth factors. The consistency allows regeneration to happen progressively. The fourth thing is timing. Do this exercise every single day. Don't skip days. The nerve regeneration only happens with consistent stimulation. You miss 3 days and you lose the momentum. The ideal time is morning because it energizes your nervous system for the whole day, but any time is fine as long as you do it daily. The fifth thing is to track your symptoms. Before you start, rate your neuropathy pain on a scale of 0 to 10. Write it down. Then do this exercise every day for 4 weeks and recheck your pain level. You should see measurable improvement. Most people see a 2 to 3 point decrease in pain within the first 4 weeks. There are 3 critical mistakes I see almost every senior make with neuropathy management. The first mistake is thinking that more intense exercise will fix neuropathy faster. People think, if gentle stretching helps a little, then aggressive physical therapy will help more. So they push themselves harder, do more intense exercises, and think they're helping. But aggressive exercise doesn't help neuropathy because it doesn't specifically target nerve regeneration. It just stresses the damaged nerves more. The simple correction is to stop doing intense exercise and start doing this specific low-intensity nerve stimulation movement. The second mistake is expecting immediate results and quitting too early. Nerve regeneration takes time. You don't see improvement in 2 days or 3 days. Most people need 3 to 4 weeks to see measurable change. People try the exercise for a week, don't see results, and give up. They think it's not working, when actually they just quit before the regeneration process had time to begin. The simple correction is to commit to 4 weeks of consistent daily exercise before deciding if it's working. The third mistake is doing the exercise inconsistently and expecting results. People think, I'll do it when I remember, or I'll do it 3 times a week. But nerve regeneration requires consistent daily stimulation. Missing days interrupts the healing process. The simple correction is to make this exercise non-negotiable. Do it at the same time every day, right after breakfast or right before bed, so it becomes part of your routine and you never forget. Now I want to tell you about Patricia. Patricia is 72 years old, and she came to see me about 6 months ago with a completely different energy than Raymond. Patricia wasn't desperate, she was quietly resigned. She'd accepted that neuropathy was just something she had to live with forever. She came in because her daughter had noticed Patricia was walking slower and had suggested she get evaluated. Patricia sat down and said very flatly, "My doctor says I have neuropathy from diabetes. I've had it for 8 years. I'm 72. I've accepted that this is just part of getting older. I don't think anything can actually fix it." Patricia's neuropathy was moderate, pain of 4 out of 10, but it was affecting her walking and her independence. She was taking gabapentin at a lower dose than Raymond. She wasn't doing any physical therapy because she'd tried it years ago and it hadn't helped. I explained the science about nerve regeneration and the step touch exercise. Patricia was skeptical. She said, "You're telling me that sitting in a chair and moving my feet is going to fix nerve damage? That sounds too simple." I asked her to do an experiment. Do this exercise for 4 weeks every single day, then come back. She agreed reluctantly. After 1 week, she felt a slight decrease in pain. After 2 weeks, her walking was slightly easier. After 4 weeks, her pain had dropped from 4 out of 10 to 2 out of 10. She could walk longer distances. Her quality of life had improved noticeably. What Patricia said when she came back was simple. I had accepted that I was stuck with this problem forever. I'd given up, but it turns out one simple exercise that I can do while watching TV actually fixed it. I wasted years being resigned when I could have been healing. Here is the concrete plan you can start tomorrow. I want you to follow these 5 steps exactly. Step 1. Today or tomorrow, assess your baseline. Rate your neuropathy pain on a scale of 0 to 10. Write this number down. Also note, can you walk without difficulty? Can you sleep through the night? Write down your baseline observations. This is what you'll compare to in 4 weeks. Step 2. Find a sturdy chair. It needs to be stable enough that you won't tip over. A dining chair, an armchair, or a kitchen chair works perfectly. Avoid office chairs that roll. You want something solid that won't move when you're doing the exercise. Step 3. Starting tomorrow morning or tonight, do the step touch exercise. Sit upright, feet flat on the floor, then alternate between lifting your toes, heels stay down, and lifting your heels, toes stay down. Do this slowly and rhythmically, 1 complete cycle every 2 seconds. Do this for 5 minutes. That's it, 5 minutes daily. Step 4. Do this every single day for the next 4 weeks, without missing a single day. Mark it on your calendar or set a phone reminder if you need to. The consistency is critical. Same time every day if possible. Step 5. After 4 weeks, reassess your pain level using the same 0 to 10 scale. Compare it to your baseline. You should see improvement of at least 1 to 3 points. If you're seeing a doctor, tell them about this exercise at your next appointment and ask if they want to monitor your progress. I need to be very clear about something. If you're currently taking gabapentin, pregabalin, or any other medication for neuropathy pain, nothing I've said means you should stop or change your medication. What I'm describing is a physical intervention that works alongside your medication, not instead of it. Your doctor prescribed these medications for reasons. Those medications still help manage pain. The exercise is an addition that addresses the root problem, nerve damage, while your medication manages the symptoms. If your pain improves significantly and your doctor feels comfortable, they might eventually reduce your medication dose. That's your doctor's decision to make based on your progress. But you don't make that decision yourself. Always discuss changes with your doctor. If you have diabetes and are taking medication for blood sugar control, this exercise might actually improve your blood sugar because movement increases glucose utilization. Your doctor might need to monitor your blood sugar more closely as you start exercising. Have that conversation with your doctor before you start. Here's what I need you to understand. Neuropathy is not your inevitable fate. It never was. Nerve damage is not permanent and irreversible. What was actually working against you was incomplete information. The belief that medication was your only option when actually your nerves have the ability to regenerate if you give them the right stimulus. Raymond said something when he came back that I think about all the time. He said, "I spent 5 years doing everything wrong, thinking I was helping myself when I was actually just managing pain. One simple exercise that stimulates my nerves actually fixed the problem. Why doesn't every doctor know about this?" That is exactly what I want for you. Not resignation. Not the quiet acceptance that you're stuck with neuropathy pain forever. Not the belief that you just have to manage it with increasing doses of medication. I want you to have the right information so that you get back control. Control over your pain. Control over your ability to walk. Control over your independence and your quality of life. Please note, this video is for informational and educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always consult with your personal physician before making any changes to your exercise routine or medications. Every person's neuropathy situation is unique, and only your doctor knows your complete health picture. If this video helped you, please like it. It takes 1 second, and it helps other seniors find this information. Subscribe to this channel and turn on notifications. That way you'll be the first to see the next video the moment it drops. And please share this with someone specific. Share it with your spouse. Share it with your adult children who are worried about your neuropathy. Share it with your friend who's suffering from foot pain and nerve damage. They need to hear this. Drop a comment below and tell me, do you have neuropathy? What's your biggest challenge with it? I read every single comment, and your answer might be the exact topic for next week's video. Speaking of which, next week I'm going to show you something that most doctors don't talk about. The one chair exercise you need to relieve neuropathy in your feet and legs fast. You do not want to miss that one. Make sure you've got notifications turned on. I'm Dr. Harold Simmons. My mission is to give you real, evidence-based information so your nerves stay healthy, your pain stays low, and you stay active and independent for decades to come. That starts with one simple 5-minute exercise done every single day. See you in the next one.